Joining us now, former candidate for vice president, senator of Virginia, Democrat, running for re-election in 2018. So far, one Republican has announced against him, and that is Corey Stewart. E.W. Jackson expected to get into the race within a week, I understand, most likely Monday or Tuesday. And then also House of Delegates member Nick Freitas also looking at getting in that fray as well. Tim Kain will be the overwhelming favorite to get reelected regardless of who the Republican nominee is right now. And he is with us now. Senator, good to have you with us.
John, great to be with you, and congrats on being wall-to-wall now in Northern Virginia and D.C.
Well, thank you so much, and we want to thank the Salem Radio Network for bringing me into their family. We're excited about that. AM 1260, The Answer. Senator, let's get to health care. The other day, President Trump saying, hey, these CSR payments are illegal. Congress didn't appropriate this money. We've been paying it, bailout to insurance companies. I've paid it for 8 months. That's over. Obama paid it. It's got to go through Congress. There's a lawsuit. But it's $7 billion. You take that out. That money's coming from somewhere. Certainly the insurance companies aren't going to absorb it. What happens now?
Well, we have the good fortune, I think, John, that Lamar Alexander, the chair of my committee, Republican, and Patty Murray, the lead Democrat, have worked together along with all of the members on the committee for 2 months now, and we put a bill on the table to basically stabilize the market by making these cost-sharing payments. These are payments that keep people's premiums, copays, and deductibles down based on income. So we would make those payments for 2 years. We would also give states more flexibility to tailor their own programs the way they want, and do a few other things, continue to outreach to enroll people, et cetera. And so this is a bipartisan proposal. One day after the bill was announced, there's 6 Republicans who have said they will support it. Democrats on our committee are strongly supportive, so we're trying to pick up as much bipartisan support as we can. And then if we can do it, we will keep people's premiums lower and stabilize the individual market for 2 years. But then there has to be a bigger discussion, and there's a number of bigger ideas on the table about the way to improve health care going forward. Let's stabilize it first, and then we can have that discussion in the committee. I've got an idea on the table, but others do too. We can have the discussion not under the pressure of the president's actions to basically destabilize the market.
Well, I want to get to your idea in just a moment, but here's my question. You're on the Appropriations Committee. The payments that were being made, the $7 billion payments, Senator Kain, being made to the big insurance companies, the Trump administration, again, claiming these were illegal payments, that they have to be appropriated by Congress. Is that true or not?
You know, I don't think it's true, John. The president was saying that, but then would make the payments a month at a time, and was taking other actions too that was increasing unpredictability. There is a lawsuit about this that has been filed by House members about these payments can't be made. I don't think that lawsuit is ultimately going to prevail, but if we can clarify it, let's clarify it. So the thing that puzzles me is that the president said he was pulling the plug on the payments because Congress needs to make them, and then we do a bipartisan deal to make them, and then the president says he doesn't like it, then he says he does like it, then he goes back and says he doesn't like it. 3 times in 24 hours the president changed his position. But look, we can't wait around for him to decide what he supports. We've just got to try to do something that will benefit our constituents and hopefully put the bill on the president's desk, and I hope if we do, he'll sign it.
All right, I want to get to what you're proposing with Senator Bennett from Colorado. Mm-hmm. You have a pretty specific proposal on the table that you're calling Medicare X. Can you elaborate on that for our listeners? Senator
Absolutely, John. So here's what our proposal is. It takes advantage of the existing system of health care that we have, so it doesn't require it to be turned topsy-turvy like either a block grant or single payer would. And it doesn't add a penny to the federal budget. It just takes the existing system and puts one more ingredient in. We would direct the HHS secretary to create an insurance plan using 3 elements of Medicare: the provider network, the reimbursement schedule, and Medicare's low administrative cost as they serve Americans in every zip code in the United States. We would have an insurance plan created. The cost of it would be covered by premiums that people would pay. We would offer the plan beginning in 2020 in every zip code in the U.S., where there's only one or fewer insurance companies writing policies. And this would be overwhelmingly in rural America where there are fewer people. But that's how we would start it. And we would give people choices there. And they could choose a public policy or choose something else. By 2023, we would expand it so that this policy would be available to be purchased on the exchange in every zip code in the United States. By 2024, we would add it to the small business exchange as well. And so the idea is to phase it in so that we can, phase it in appropriately and learn as we go. But it just takes the existing system and adds one ingredient, which is a publicly available plan that would provide the essential health care benefits required by the ACA, but giving people something that they can comparison shop to with any private offerings that are being made to them.
All right, I've got 2 minutes. So just for our listeners, Senator Tim Kain, let me just break this down. So what you're suggesting is I'm an independent businessman, right? So if I want to buy my insurance and I don't qualify, obviously, for Medicare or Medicaid, right? Not within those economic boundaries. But I say, look, I just want to buy it. So I'm going to get a rate, and then I can make the choice, buy it or not buy it. And if I do buy it, it's going to pay for itself because I'm paying for it. So not add to the debt, not add to the cost structure.
No new taxes to cover it.
No new taxes.
Absolutely.
I want to buy.
So, you'd set it actuarially so that you would pay the freight, but it would be a choice. If you would rather buy your policy from Anthem or whoever else you want, no skin off our nose, that's fine. But we would offer this. Again, in this rolled-out way, we would offer it so that everybody would have more choices. And, John, it responds to the two concerns I hear from people all around the state. They want to maintain benefits like pre-existing condition protection, but they want more choices and they want more affordability. And if we do this, we will provide those two benefits.
So what's the conservative argument in opposition to this when it's my choice, I pay for it, doesn't add to the debt, and if I don't like it, I don't have to buy it. I buy something else. What's the counter argument that you've heard?
Well, the counter argument is likely to be from some on the committee. Well, we don't want another government program. But again, if it's completely covered by costs, it's like in most jurisdictions, if you live in, your water comes from the government, and you're a ratepayer, and you pay a water bill. So the costs are going to be covered by the ratepayer, in this case, folks that buy the insurance policy. But some don't want more government role. The difference between this and single payer is if you don't want a government insurance policy under our plan, you don't have to have it. You can buy insurance from others that are offering insurance if there are. But as you know, the problem in a lot of rural America is there's very few companies offering insurance because there's fewer patients, so there's just not enough business. The patients tend to be a little bit older and then a little bit sicker. Right. And so what we see is if you live in a metropolitan area, there's usually a number of insurance companies willing to write policies on the exchange. But if you live in rural America, that's not the case. So that's why we want to roll it out first in the jurisdictions that where there's really no competition.
It adds competition. It adds choice. The government program doesn't have to be created. It's already in place now. Whether you expand it or not doesn't matter if you're paying for it. And so as looking at this, I have to say to myself, why wouldn't anybody want to go forward with this option? If you don't want to buy it, don't buy it. If you do want to buy it, you've now got an option. And this is the discussion that I think we're going to have, John, on the Health Committee. If we can get this stabilization bill passed to stabilize the market for 2 years, then Lamar, Alexander, and Patty Murray have said, then we'll have a deliberate, careful discussion with a lot of public transparency about the different options on the table. We don't only have Bernie Sanders' proposal. We have the Graham Cassidy proposal, which is just to block grant everything back to states. Right. Every idea should get its moment in the sun. We make our best case. We try to explain why we think it's best. Michael Bennett and I are very proud of this, and we think it's going to be a path forward that will save people money and give them more choices. All right, I got to take off. We're out of time. I want to thank Senator Tim Kain for being with us. Senator Kain, Medicare X, I think you're onto something. Thanks for joining us today. More information, timkain.com. Senator, as always, thanks for being with us, sir.
You bet. Talk to you soon, John. See you.